All right, well, good afternoon, everybody, and thank you for joining today's media briefing with the Department of Public Health. As always, Dr. Ferrer will give us a situational update on COVID-19 in LA County. That'll be followed by a time where we'll take your questions, and then we'll make remarks in Spanish. If you have a question and would like to be put into queue, please click on the hand icon that's in the participant panel on your right-hand side, and that'll put you into queue. And with that, I'll turn things over to the Director of Public Health, Dr. Barbara Ferrer.
Thanks, Tim, and thanks everyone for joining me for today's briefing. This afternoon, I'll be talking about our trends in cases, hospitalizations, and deaths by vaccination status, age group, and race and ethnicity. And we'll also review our progress with vaccination, including vaccinating homebound residents. I'll close with some ideas for ensuring a safe Labor Day as we all pay tribute to the contributions and achievements of our workers and our labor unions. I'll take the first slide. We're sad to report 43 additional deaths today. At least 33 of the people who died had underlying health conditions. This does bring the total number of deaths to 25,364 in LA County. To everyone who has lost friends and family during this difficult time, we're wishing you peace and comfort, and our prayers remain with you. We're reporting 2,741 new cases today, which brings the total number of cases in LA County to 1,412,240. To date, more than 8.1 million people have been tested and had test results reported in LA County. Our daily test positivity rate is about 2.97%, as this is a slight increase from last week's same-day rate of 2.75%. Our daily average case rate with a 3-day lag is now 22 cases per 100,000 people. This is a more than 4 percentage point decrease from last week's 3-day lagged case rate of 26.6 cases per 100,000 people. There are 1,673 people currently hospitalized with COVID-19. Again, this is a small decrease of about 58 people over the past week. We currently have 295 open investigations at residential congregate settings and non-residential settings with at least one confirmed case of COVID-19. We can go on to the next slide. In order to assess the risk of COVID in LA County, we do use the CDC indicators and thresholds to categorize community transmission of COVID-19. You'll note that this framework uses a cumulative 7-day case rate, meaning that this is the number of cases per 100,000 people over the past week, rather than the daily case rate. While transmission in LA County remains at the high level, with our 7-day cumulative case rate now at 159 new cases per 100,000 residents, this case rate represents a welcomed 16% decrease from last week. And this is in fact the second week in a row with small decreases in our case rate. Overall, we've seen a 22% decrease from our peak of 204 cases per 100,000 people on August 19th. Next slide. As LA County continues to implement safety measures, and we work with all of you to do that, that are what's helping us slow the spread, it's useful to note where we're seeing progress. When we compare cases that were reported in the week ending August 15th with those reported in the week ending August 22nd, LA County went from seeing nearly 22,000 cases to seeing about 17,800 cases, and that's a decrease of about 19%. Meanwhile, in the remainder of the state, reported cases went from over 64,000 in the week ending August 22nd to just under 62,000 for the week ending August 29th. This was a decrease of 4%. We're grateful to all the work that everyone's doing so that our case numbers continue to fall both across the county and the state. Next slide. This graph shows the trends in cases, hospitalizations, and deaths in our county from the beginning of the pandemic through August 25th of this year. Over the course of the pandemic, we have seen cases peak and decline. And as you can see, on August 25th, cases, which is represented by the green line, were at almost the exact same level they were a month earlier, averaging a little below 2,400 cases a day. We anticipate that with increased routine screening testing over the next few weeks, our case numbers could increase again. Hospitalizations may be plateauing or even decreasing slightly at their current level of about 1,700 people hospitalized on a given day. As deaths lag even further behind hospitalizations, we anticipate continuing to see, tragically, dozens of deaths reported each day. This past week, we did see a very small decline, about 11% from the prior week, to a 7-day average of 17 daily deaths. However, as you've noted, our reported numbers yesterday and today are higher, and we fear continued losses that are particularly difficult to bear because they are all just about all preventable with our widely available and safe COVID vaccines. Next slide. As always, we track the effectiveness of the vaccines by looking at the experiences of everyone vaccinated. This slide shows data for those fully protected by the vaccines to scale. The large green box represents the nearly 5.3 million residents that are fully vaccinated. The tiny purple box in the left lower corner of the green box represents the 37,614 fully vaccinated people who tested positive for COVID as of August 31st, 2021. While this is an increase of 15% from the numbers we shared last week, it's important to note that less than 1% of all of those who have been vaccinated have become infected with COVID. Of those who have tested positive, 1,049 people were hospitalized. This is up from 881 the week prior and translates to 0.02% of all fully vaccinated people ending up hospitalized. Deaths in this group over the same interval also increased from 95 to 118, and this now amounts to 0.0022% of all fully vaccinated people tragically passing away. These small increases are evidence that the vaccines do not provide 100% protection from infection, from hospitalization and deaths. And this is not a surprise to us. When community transmission is high, more fully vaccinated people are likely to get infected. But these numbers also show us that while vaccines are imperfect, people who are fully vaccinated are extremely well protected from COVID-related hospitalizations and deaths. Next slide. In the next set of slides, I'll be showing outcomes by vaccination status, stratified by race and ethnicity, as well as by adult age groups. In all of these slides, unvaccinated groups are represented by dotted lines, while vaccinated groups are represented by solid lines. The first slide shows that the highest case rate is now among Latinx unvaccinated people, represented by the dotted gray line, followed closely by Black and white unvaccinated people, represented by the blue and red dotted lines. After months of seeing the highest case rates among our Black residents, this represents a notable change. Looking at the dotted blue and gray lines representing rates in Black and Latinx residents, you can see that the reason for this change is that the rates among Black residents have declined more quickly than the rates among Latinx residents. And these are both for those people who are unvaccinated. You can also see on this slide how different the picture is now than it was at the end of July. On July 24th, 422 people out of every 100,000 vaccinated Black residents were infected with COVID, the highest rate amongst all racial and ethnic groups. And it was more than 4 times as high as the rate among those vaccinated Black residents, and nearly twice as high as rates among Latinx and white residents. That changed in August as cases have declined among all groups. Next slide. On this slide showing case rates in adults by age group, you'll note that the rates differ considerably both by vaccination status and by age group. The highest rates are among unvaccinated adults between the ages of 18 and 49, represented here by the dotted purple line. The next highest case rates are among unvaccinated older adults, represented by the dotted yellow line. And below them, vaccinated younger adults in the solid purple line, and vaccinated older adults in the solid yellow line, having the lowest rates. Unvaccinated adults in both age groups are 4 to 5 times more likely to get infected than vaccinated adults. The higher risk in younger unvaccinated individuals is likely due to their intermingling with many others at their jobs, at schools, and in their social lives. You'll note that in all groups, cases have peaked and are now declining. This trend is particularly dramatic in the unvaccinated age groups, which also had a steeper increase in cases earlier in this latest surge of infections. The decline may be related to the implementation of additional layers of protection, including universal masking indoors, and also to increases in overall vaccination coverage, which reduces the number of people who are unvaccinated and also reduces the likelihood of people transmitting infections to others. Next slide. When examining the data on hospitalizations, you can see that the highest hospitalization rates are among unvaccinated Black residents, represented by the dotted blue line, followed by unvaccinated Latinx and white residents, represented by the red and gray lines. Meanwhile, hospitalization rates remain very low among vaccinated individuals of all races. It does appear that hospitalization rates declined for Black unvaccinated individuals over the first 3 weeks in August, and that they've stabilized for other groups, providing hope that if we can keep our case numbers declining, hospitalization numbers will also subsequently decrease. Next slide. When we look by age group at who is now getting hospitalized, we see that the highest hospitalization rate continues to be among older unvaccinated adults, represented here by the dashed yellow line. While there has been some stabilization in hospitalizations in this age group, unvaccinated adults 50 and over were still more than 18 times likelier to be hospitalized than their vaccinated counterparts. Hospitalizations in younger unvaccinated adults, and that's represented here by the dotted purple line, declined slightly, and they're 39 times higher than the hospitalization rates for vaccinated 18 to 49-year-old residents. Relative to unvaccinated adults, hospitalization rates among vaccinated adults of all ages remain very low. Next slide. Vaccinations continue to show us that they provide robust protective effect against death due to COVID. As you can see here, death rates are nearly flat in all vaccinated groups, while death rates in unvaccinated groups are fluctuating. Notably, while most unvaccinated racial and ethnic groups are seeing a plateau or even a small downward trend in death rates, the death rate among Black residents, already the highest, continued to rise throughout the end of August. With deaths a lagging indicator by an average of about 35 days, this is likely a consequence of the fact that hospitalization rates in our Black communities have been higher than those in all other racial and ethnic groups for most of this latest surge. Next slide. Looking at death rates by age group, we see that unvaccinated older adults continue to be at much higher risk than any other group, vaccinated or not. Unvaccinated adults over 50, represented by the dashed yellow line, are 20 times more likely to die of COVID than their vaccinated counterparts. Next slide. Our recent rise in cases reflects the reality that the Delta variant now accounts for nearly all the COVID strains seen among sample sequence in the LA County area. As you can see on this bar chart, which shows the number of cases accounted for by different variants of concern, Delta variants, represented by the red bars, now account for 99% of all sequence strains. This variant is more efficiently transmitted between people, likely due to its faster replication, higher viral load, and greater affinity for lower respiratory tract cells when compared with earlier COVID strains. And while emerging data affirms that fully vaccinated people are well protected from severe infections with the Delta variants, it is now clear that fully vaccinated people can become infected, and if infected with Delta, they can infect others. Next slide. I also wanted to update you today on cases and deaths among the staff and residents of skilled nursing facilities in LA County. Since March 1st of this year, we've had 497 positive cases among skilled nursing facility staff and 264 cases among residents. This is across our 340 nursing homes, where we counted about 38,000 staff and slightly more than 26,000 residents. Among the positive cases, 42% were among fully vaccinated people. This is in part because of the very high numbers of fully vaccinated residents and staff at the skilled nursing facilities. As of August 26th, 87% of residents and 88% of skilled nursing facility staff in LA County were fully vaccinated. We've also seen 10 deaths among residents of skilled nursing facilities, 1/3 of which were among fully vaccinated people. Almost all of these deaths were among residents who had serious health conditions, and there have been no deaths reported among the staff of these facilities. And I do want to again send my condolences to everyone who's experienced the death of a loved one. This stands in sharp contrast to the experiences at nursing homes during earlier surges. Over the winter surge between November 1st of 2020 and February 28th of this year, 9,021 residents were infected and over 2,000 died. We also had high numbers among staff, of whom over 4,500 were infected and 46 passed away. So while we continue to see some transmission of the Delta variant in our nursing homes during this current surge, vaccinations have clearly been a game changer by offering extraordinary protection against significant spread among some of our most vulnerable residents. Next slide. As always, given the power of vaccines, we remain focused on making it easy for those not yet vaccinated to get vaccinated. As of August 29th, 91% of LA County residents 65 and over have received at least one dose of the vaccine, as have 75% of residents 16 and over and 75% of residents 12 and over. 65% of residents 12 and over are fully vaccinated. 62% of LA County teens between the ages of 12 and 17 received at least one dose, and 51% are fully vaccinated. Countywide, almost 36,000 third doses have been administered to immunocompromised people. Out of our nearly 10.3 million LA County residents, including those who are not yet eligible for the vaccine, 64% have received at least one dose, and 56% are fully vaccinated. Next slide. This chart shows the number of first doses administered each week, although please note that due to a lag in data reporting, numbers for the latest week often underestimate the number of doses administered by anywhere from 4,000 to 10,000 doses. This chart currently indicates that between August 16th and the 22nd, we administered a little over 63,000 doses across the entire county network. In order to avoid these cycles of surges, we do need to see this number rise significantly if we're to take a different path through the coming months. While we're grateful for everyone who's been vaccinated, we must continue to explore ways to talk to each other about the vaccines that communicate the reality of their safety and effectiveness, and that invite people in rather than pushing them out. Next slide. Persistent gaps in vaccination coverage continue to haunt us between age and racial and ethnic subgroups. Groups with vaccination rates below 50% are marked in red, while the remainder are in white. While we're glad to see many groups vaccinated at rates above 50%, we must confront the reality of what isn't on this slide: the percent of people in each of these subgroups that aren't vaccinated. These are the people we most worry about, those who haven't received even one dose of vaccine. Repeatedly, we're hearing reports from healthcare workers caring for severely ill adults, many of them parents with children, for whom it's too late to get vaccinated. We're also hearing of hospitalizations and occasionally tragic deaths among unvaccinated young adults who opted out of vaccination because they didn't think the virus was a threat. These people and so many others are the ones missing from this chart, and they are the ones we must reach if we're to end this pandemic. So while we're glad to see that all age groups summed in the bottom row of this chart have reached a 60% vaccinated benchmark, we need to focus our efforts at the unvaccinated people in the gaps. As you can see in the rightmost column, there are large numbers of unvaccinated people in all racial and ethnic groups, although Black and Brown communities have higher proportions of unvaccinated folks. It's not a coincidence that the communities with the lowest vaccination uptake are the ones who have historically had the lowest access to high quality, affirming, respectful medical care. And while repairing the damage caused by structural racism will not happen overnight, we need to see faster gains to turn around the disproportionality in cases, hospitalizations, and deaths, which, as these tables have shown, are so closely linked to vaccination status. Next slide. With support from the many vaccination partners across the county, we are able to see some increases in vaccination rates in communities that have persistent low vaccination coverage. The higher vaccination rates that are represented by the dark green on this map now include northern cities and communities like Santa Clarita and Stevenson Ranch, areas to the east of our county, including West Covina, and parts of central LA, including Burbank. All of LA County thanks you for doing your part to slow the spread. Next slide. We do have a continued strategy for improving access to vaccines by having our mobile vaccination teams take vaccines to places where we can reach people not yet vaccinated. The blue markers on this map indicate the 480 sites where our mobile teams are offering vaccinations this week, many of which are concentrated in the higher need, harder hit areas. Our mobile vaccine teams work to get vaccinations into the neighborhood places where people gather, and they're eager to make vaccines easily available to all of you. Anyone can request a mobile team on our website, and meanwhile, you can look for our teams at the places in your community where people come together. Next slide. Ensuring vaccine access to our most vulnerable residents is one of our highest priorities, and our in-home vaccination program offers home visits to provide vaccines to those that are medically unable to leave their homes. If you're homebound, you can refer yourself to this program, but caregivers, family members, and loved ones, healthcare providers, organizations, and others can also make referrals. We have so far vaccinated 2,000 homebound LA County residents through this program. And we're also able to offer additional doses for immunocompromised homebound residents. To submit a request, you can visit our in-home vaccination request form at the website that's listed on this slide, or you can also call us at 1-833-540-0473 between the hours of 8 a.m. and 8:30 p.m. 7 days a week. We can take calls in multiple languages. Once we've received your inquiry, mobile providers will contact the client directly within about a week to schedule an appointment. On our vaccine website, you can also click in-home vaccination in the menu to the left of this page in order to get more information. Next slide. As we enter the Labor Day weekend, many of us will have opportunities to engage in a variety of activities with friends and families. And many of us will be asking ourselves whether it's safe for us to do the things we want to do. When making plans, it might be helpful to think about the different places where risk comes from when you're engaging in activity. For starters, there's your own personal risk. That risk is on a spectrum, and it changes on the basis of a whole lot of factors. Having everyone in your household, including yourself, vaccinated, working alone or at home, being younger than 65, and having a healthy immune system and no chronic conditions all lower your personal risk. While having unvaccinated people at home, having sustained close contact with others at work, being 65 or older, immunocompromised, or having many chronic conditions all increase your personal risk. Not all of these are binary. There's a difference, for example, between having one unvaccinated infant at home and living with 4 unvaccinated adults who are all going to work and mixing a lot socially. And these are certainly not all the characteristics that contribute to personal risk. Where you live, how easy and safe it is to access healthcare, and many other factors can increase or decrease risk. But you can consider this as a blueprint for beginning to evaluate and even in some ways assess your own personal risk. It's a good idea to know whether you fall closer to lower risk or the higher risk side of this spectrum. Next slide. Once you've taken some time to think about your own personal risk, think about the risk of the activities you want to take part in. These also fall along a spectrum of risk. Activities that are outdoors generally have lower risk associated with them than those that are indoors. Knowing everyone involved in an activity will be fully vaccinated further lowers the risk of that activity, while not knowing others' vaccination status or knowing others are unvaccinated can increase the risk of activities with those people. Activities in uncrowded places generally carry less risk than those that involve crowds, as do activities where you and others are masked for the duration of the activity. And lastly, people are less likely to transmit infection when they're being quiet than when they're singing, shouting, or breathing hard, as during a workout or participating in a band. Some activities will fall entirely on one end or the other of the spectrum. A distanced mass book club or Bible study in your backyard might have all of the qualities on the lower risk side of the spectrum, while a boisterous party might have all of the qualities on the higher risk side of the spectrum. But a lot of activities will have some qualities from both sides. For example, if everyone in your backyard gathering stands up and unmasks to crowd around the snack table for half an hour, that will increase the risk of that activity. Again, we're thinking of risk on a spectrum. If everyone engaged only in lower risk activities, regardless of their personal risk, very few people would transmit or catch COVID. But out of necessity or sometimes out of desire, people do engage in higher risk activities, including people with high personal risk. Next slide. So what can we do with this information? I'll take the next slide. As you assess your personal risk, remember that if you live with others, there is additional risk for each person in your household. The more protections you and those in your household have, the safer you are, not only personally, but for the benefit of those you love. Other protections might involve modifying the activity itself, like opening some windows or doors, or encouraging your friends to move a gathering outside where you can all spread out. The higher your personal risk and the higher the risk of the activity, the more important it is to layer in additional protections before going out to enjoy all that LA has to offer. Next slide. For an example of how this might work, imagine a family of 4 with 2 vaccinated adults and 2 unvaccinated young children. They want to attend a large fair at a local park sponsored by the city, with amusement rides, food booths, and fireworks. It's estimated that 5,000 other people will attend. When mom thinks through her family's personal risks, she thinks of her 2 unvaccinated children. She also thinks of her and her partner's workplaces. They work in retail and food service, but wear masks the entire time they're at work. Both she and her partner are in their 30s, and she notes with gratitude that they're both healthy. She estimates their personal risk as a family is probably somewhere in the medium range. Meanwhile, when she assesses the risk of going to the fair, she thinks about the open air carousels and the Ferris wheel, as well as the crowded ring toss and the indoor funhouse. She notes the fair doesn't require proof of vaccination for entry and expects some people there will be masked while others will not. And she hopes it'll be enough fun that lots of people will be laughing and shouting and singing. Overall, she estimates that as an activity, the fair has a medium to high risk, although she knows that the risk is variable, and she's aware that there are steps they can take as a family to protect themselves. This family may decide to go to the fair, taking sensible precautions while having a great time. They can do this by layering on protections that match the risk of the activity. Wearing masks except when they're eating ice cream with their legs dangling off the pier, taking advantage of the outdoor activities and rides while staying away from the carnival games and the funhouse, and generally avoiding the most crowded areas of the fair, which might mean watching the fireworks away from large groups of people. What if one of the parents is diabetic or a grandparent who takes an immunosuppressive medication watches the kids while the parents are at work? That changes this family's personal risk, so it should also change their calculations. They might decide to take on a lower risk activity, like having an outdoor gathering where they know all their friends and families are vaccinated to celebrate the Labor Day holiday. Or if they do go to the fair, they might all double mask and be extra careful to stay on the periphery of the action, especially if they're eating or drinking. Although some of what we do with our time is not up to us, many of us do have some choices we can make about how we live our lives right now. There is great power to protect ourselves and each other in those choices, and approaching them thoughtfully is our path through this together. Thank you, and I'll take your questions in a moment. But before I do, I just want to correct something I said in response to a question yesterday. I was asked what proportion of all our testing was comprised by LAUSD surveillance testing, and I estimated it might be as high as 60%. But after running the numbers for the past 2 weeks, the correct number is in fact closer to 40%. With that, I'll now take your questions.
And our first question will come from Claudia Pesciuta with KNX.
Hi. Okay, a couple of questions. We had talked about this last week, and you said that you guys would be looking into it. Why do you think Latinos are leading the way again on case rates? And then on that chart for Delta for the week of 8/21, there's a big drop, and I'm wondering if that just means that there was less sequencing that was happening. And do we know how many breakthrough cases? How many of the cases in August were breakthrough and on vaccine demand? So it doesn't look like we saw any kind of a boost from the full approval for Pfizer. Is that right? Thank you.
Yeah, thanks so much, Claudia. Let me start with the last one. We haven't seen a boost here. I think there have been places where they have. Again, we're out there every day with our partners trying to make sure that it's accessible and that people have information, particularly now that it is fully approved. Pfizer is fully approved for those that are 16 and older. In terms of the percent of our new cases in August that were among people who were fully vaccinated, we'll calculate those numbers and share them with you next week. Obviously, we just came to the end of this month, so it'll take us a few days to run all of those numbers, but we'll present that next week. In terms of the drop you saw in the sequencing, thanks for asking me. I should have mentioned that's just a delay in getting the reports in. So, often these reports come from many different labs, so it takes a while for all the reports to get into us. You usually see this every time we show the tables on the sequencing. As the most recent tables have less specimens that we've already gotten the results from, but that usually evens out over time. So I don't think there's actually been a drop in sequencing. I think it's just a delay in getting all the reporting. And in terms of the Latinx surge in cases, we are looking into this. I mean, we believe that it's associated again with the fact that many more people are back at work, that there's a lot more intermingling, that again, Latinx and Black residents make up a large part of some of the essential workforce, where there now may be more people coming into those establishments, and therefore there may be some more exposures. What we are grateful for is that the rates are coming down across the board, but obviously, watching this very carefully. And thanks. With that, we can go on to the next question.
That'll come from Ryan Carr with the Daily News.
Yes, thank you. Thank you, Dr. Ferrer. Maybe just kind of trailing off that point. If I'm understanding you right, you're seeing the beginnings of what potentially could be a plateau here. But if I'm understanding that correctly, the plateau is maybe somewhat deceptive because it is not a function of just sort of the virus sort of petering out, but it's because perhaps of the masking and back toughening up on masking and vaccinations. But you're saying that if the vaccine rate is not sort of picked up, that plateau won't last, and we'll just sort of be caught in this cycle of rises and then falls, depending on, you know, the getting the measures back in place again at each rise. So forgive me for rambling there, but I wondered if I'm understanding that right.
Yeah, no, it's a tough question, and thanks for pointing this out. Like it is a little bit hard to establish with certainty where we are right now in LA County. Our clearly our test positivity rate is remaining relatively low, although our case numbers and our case rate is relatively high. So it's important to note that we are seeing less transmission across the board in general, but because the Delta variant is so capable of infecting lots of people, we still have very high numbers of people getting infected. And, you know, while in LA County, you know, you look at our numbers and you'd say, well, we have tons and tons of people vaccinated. As I pointed out today, we do. But we also have tons and tons of people that are unvaccinated, a very good reservoir for a highly infectious variant. And so it is with caution that we note the decline. Now, we have in fact put in some safety modifications. I think indoor masking is one of the biggest modifications, and I think it does make a difference. But we also know, and we've seen this before, that viruses can also oftentimes go ahead and peak dramatically and then dramatically decline. And it's unclear to us with the Delta variant if that might be part of what's contributing to what looks like a small decline at this point, but could become a larger decline. I've noted that, you know, we're not making any predictions in this go round because there are some things that are still creating additional risk for us. The first is that, you know, we're returning about 1.5 million children and about 200,000 educators that support them back to our schools. And those folks will be in much closer contact with each other than many of them have been for the duration of the pandemic. And while I want to applaud all the schools, and I talked a lot about this yesterday with Dr. Eduardo, for doing everything they can to create safety, the bringing together of so many people within a short period of time does create some additional risk, particularly with community transmission numbers still being high. So you know, our team here is prepared to see another increase in cases over the next few weeks as we have, again, large numbers of people intermingling in new settings. My hope is that it doesn't turn into another large surge because we are, while slow, still getting more and more people vaccinated. So thanks to everybody who is coming in to get vaccinated. And at all of the sites, particularly the schools where lots more people are coming, we're doing a lot of work around introducing safety modifications. So I hope that answered it. It was a complicated question, and I'm not sure I tried to do it justice, but it's something we're watching carefully. I'm not prepared at this point to say we're going to see a rapid decline yet in cases here in LA County, although hopeful that over time we won't see very large increases.
Right. Thank you for that, doctor. I think the thing for me was just when you had mentioned sort of, you know, the potential for a cycle of surges and
Yeah.
you know, ups and downs.
Yeah.
Struck
I
me.
mean, I think as long as you have lots of unvaccinated people, which is why there's so much risk at schools. I mean, everybody under 12 is unvaccinated. As long as you have lots of people who are unvaccinated, we're kind of at the mercy of a lot of transmission, and it can happen in these cycles, some of which may be driven by the virus itself, and some of it may be driven by the virus's interaction with human beings. But I do worry that when you have a lot of people that are unvaccinated, there can be both a fair amount of transmission still, and in that transmission, additional mutations. So maybe, you know, we're similar to, like, you know, we had the California variant back during our winter surge. Now we have the Delta variant. Without enough people getting vaccinated very rapidly, we could get another cycle later on in the fall or the early winter, caused by even another variant, because we have a lot of people still not vaccinated. We have to be super careful.
Next question will come from Ron Lynn with the LA Times.
Hi, Dr. Ferrer. Thanks so much for taking our questions. We have questions today on the risk of breakthrough transmission among vaccinated people, grandparents, and herd immunity. First, I understand that vaccinated people can easily transmit the virus to unvaccinated people. But what's the risk of a vaccinated person transmitting the virus to another vaccinated person and then brings it home to a kid too young to be vaccinated? The second question is just one on risk. So, and thanks for that that overview that you gave. What would you say to fully vaccinated parents or grandparents who are having to decide whether to go to an indoor gathering with other adults where they suspect most people are fully vaccinated? Is it still too risky for them to go there because of the risk they might bring the virus back home to children? And then finally, in May, which seems like, you know, a century ago, you mentioned hope that in midsummer, it was hoped that 80% of all residents 16 and older would be vaccinated. And I think you said that that was a good estimate of herd immunity at that time. We're now at 75% of those aged 16 and plus with at least one dose. Do you think we're close to herd immunity, or has Delta just scrambled everything up? Thanks so much.
Yeah, thanks so much, Ron. And we'll start with the last question. Those predictions were made pre-Delta. I think Delta has scrambled everything, mostly because it's so much more infectious. We'd love to get to 80% of people fully immunized, 16 plus. Now, at this point, we actually can do it at 12 plus because we're at 75% for 12 plus. So let's aim for the group of folks who can be fully immunized. I think if we get to 80%, that would be great, fully immunized, and it will provide us with a lot of protection. I don't think it gives us herd immunity with the Delta variant. I mean, herd immunity is when transmission just becomes a very low possibility or probability, and with a highly infectious variant, we're going to need to probably get those numbers higher. So, but 80%, if we hit 80% fully vaccinated, that would be a great step forward and would provide a lot of additional protection that we don't have right now. In terms of breakthrough cases, what is the risk for sort of vaccinated people transmitting to other vaccinated people? One thing is for sure, vaccinated people can get infected and they can transmit to other vaccinated people. So they can transmit obviously to unvaccinated people, but they also can transmit to vaccinated people. Vax-on-vax transmission has happened. There are studies that have documented it well. So it's not sort of, maybe we think it's happening. It obviously is happening. It happens, it's more likely to happen and you're more likely to hear about it in those settings where almost everybody is vaccinated. But there's, lots of intermingling with some people that may not be vaccinated, people bringing back, which almost gets to your second question. So vaccinated person brings back, gets infected, brings it back. They're hanging out with almost all fully vaccinated people, but because it's possible to have transmission, you in fact are going to see cases there if the conditions are, make it easy for that transmission to happen. And that's why we've obviously recommended indoor masking for everybody, regardless of vaccination status, is an acknowledgement that vaccinated people can transmit to other vaccinated people. So when you're indoors, keep your masks on, particularly where you're in settings with lots of people who you may not know their vaccination status, or just lots of people. The sheer numbers are working against us right now. The more people there are in a setting, the more likelihood there can be with a highly infectious Delta variant that somebody in that setting could be infected. So that situation for grandparents and parents really depends on some of the other factors. How many people are there? How crowded are you? What does indoors mean? Are windows open? Is there a lot of ventilation? Are people unmasking for longer periods of time while they eat and drink? all of that increases risk. And, people then have to assess that. If it's a smaller group, you pretty much know everybody, you're all vaccinated, you're being super careful around all of the other protections you can build in. The windows are open, the doors are open. When not eating or drinking, people are quickly masking up or removing the eating and drinking activities to outdoors. That all makes that indoor setting a lot safer. And those are the kinds of considerations that people will need to take into account when they assess what it is that they want to do based on but their own risks, their own personal risks, and the risks of transmitting to others who they live with, who they love, or who are at their workplaces or in their communities. So I think I got to all your questions. Thanks a lot, Ron. Go on to the next question.
The next question will come from Kirthi Vidanam with .la.
Hi. How many people, what percentage of
Having a lot of trouble hearing you. I don't know if you could speak up.
Yeah, sorry about that. I was wondering what percentage thoughts in order to
Couldn't really get your question. I'm so sorry.
Yeah, Kirthi, if you can, just text it to me on the chat and I'll ask Dr. Ferrer. So in the meantime, we'll go to Peter Nichols with Melrose Action.
Hey, good to see you, Dr. Ferrer. Thank you so much for taking our calls and questions. Hey, I want to focus in on the R effective rate. So I follow it all the time, and people I work with at UCLA do as well. And it's taken a precipitous drop. In fact, today's ensemble estimate is about a 0.86. And it's following the same pattern familiar to us in the winter surge. So in taking your observations and then seeing today, I'm looking at the state's projections on hospitalizations here for tomorrow, shows another 2% decline and a further lowering it. And then looking at the state's projections on hospitalizations going 30 days out for LA County, it's showing a decline of about 30%. And then the ICU rate literally going down 50% 30 days from now. Taking that into consideration, and then a piece in the New York Times saying, has Delta peaked, question mark, given these ups and downs, and as you aptly pointed out, why isn't it not possible that we are, going down the same, I don't want to say rabbit hole, but the decline that we've seen before? What's different now?
Yeah, it's a great question. Thanks, Peter. I think what I've alluded to is we're bringing back 1.5 million children into schools, 200,000 staff and educators to support them. That's a lot. It's over 3,000 buildings opening up, many of which were closed completely, and those that were opened for much smaller numbers of people to be indoors, on sort of more staggered schedules for learning. So that's the big if. It's a lot of people. It's a lot of unvaccinated people in settings where people are going to be close to each other. Again, the work that's being done by parents, students, educators at every school is phenomenal. And really breathtaking in many ways. I mean, imagine just reopening schools and then add to that the complexity of layering all the safety. But even with that, there's the probability, as we've seen, that there can be lots more cases. So I want to just go ahead and let's get through the first few weeks of school reopenings. Let's see what our numbers are telling us. I want to thank everybody who's participating in the testing programs. That's super helpful to catch cases as early as possible. And then, acknowledge that while disruptive, the isolation and quarantine is the way we mitigate against a lot of spread in the schools. So thanks to everybody who's doing that. Let's look at our numbers over the next few weeks, and I think that will give us a much better sense of where we are in this cycle with the Delta variant right now. With that, we can go on to the next question.
Okay. And Dr. Kirti texted a question. It was
Okay,
asking about
sure.
herd immunity. She asked
Yeah.
how many people need to get the booster shot to preserve herd immunity in the county.
Yeah, it's a great question about the booster shots. You know, obviously need to wait for CDC and the FDA to complete their studies and their analysis of the data that's been collected on where we are in terms of the current efficacy of they're looking at Pfizer and Moderna right now, the Pfizer and Moderna vaccines, in terms of, you know, what the data is showing us about how effective these vaccines are at preventing, you know, most importantly, serious illness and death, but also they're looking at what's happening with transmission among fully vaccinated folks. So we'll wait and see what we hear back. They're looking at this data right now, and I'm sure they'll be making recommendations back to all of us for sometime in the middle of September. We should hear back whether there is a recommendation for a booster. I mean, the idea behind a booster is that the 2 doses that we received, if we're fully vaccinated, gave us a lot of protection. So this is very different from the 3rd dose that's being given to people who are immunocompromised, where they didn't get a lot of protection necessarily from the first 2 doses and needed that 3rd dose to just get enough protection. This is really a different story. This is for people who got 2 doses. The doses provided a lot of protection. But over time, as with other vaccines, that protection can wane. The issue is the timing. When has it waned enough that it's really warranted for us to go ahead and get those boosters? I do want to reassure everybody that at whatever the decision is, and whenever the decision gets made that we need those boosters, you know, here in LA County, we are obviously doing all the planning now so that depending on the recommendations coming out of CDC and FDA, we'll be ready here to go ahead and administer boosters as folks become eligible and as recommended by CDC. And I think we only have time for one more question, Tim. So.
Okay, and this comes from Alexis Oliver Rish. They sent that in as a question on the chat, asking about outbreaks. How long does it typically take for the department to confirm outbreaks? And then do we have more information on outbreaks with LAPD?
Oh, you know, great questions. I mean, we send in an outbreak team to work with sites that have outbreaks. I mean, some of that is done initially via phone, where we talk to everybody. Once you've had what we call 3 or more cases at your site over a 14-day period, we like to get notified, and we like to help you decide whether or not that those cases indicate that there's transmission happening at your work site. Or in, you know, at a school. Those are other places where we're helping out. Outbreaks can last many, many weeks, unfortunately, because of a long incubation period, 14 days. It's why it's so important that people who are close contacts are tested as quickly as they can get tested, and that they're quarantining for the appropriate time. For adults and for workers, that's a 10-day quarantine. You can come out of the quarantine as long as you're asymptomatic and watch yourself all the way through day 14. But it is, you know, it's both a time-consuming task and an essential task. Is to, once there are cases that are identified, we need to figure out those close contacts, and where those close contacts are people at work, we have to watch very carefully how much transmission may be happening from a case to one of their close contacts. When at work sites you see that transmission, a secondary infection, you can go ahead then and have a whole nother cycle that you have to work on, because now that close contact becomes a case, and you have to figure out who were all of their close contacts, do all those interviews, and make a determination on which of those people need to get quarantined. And this can go on for quite a while, which is why we always recommend testing people who are close contacts now, so that very quickly we can try to figure out if there are people that are positive and start with that additional contact tracing and isolation and quarantine of a larger number of people. But thanks for that. And again, I want to thank everybody. As a reminder, We will be doing 2 press briefings a week. One press briefing will be with Dr. Eduardo or somebody from from somebody from LA County Office of Education, to just spend time talking about schools and reopenings at schools. And the other will be our usual press briefing where we'll cover everything else. So thanks a lot.
Again, if you had a question we didn't get to you, you can send us an email at media@ph.lacounty.gov. Thank you for joining us today. We will begin our Spanish remarks in just a couple of moments. Monica, are you ready to begin?
Yes, I am ready.
Okay. We're ready when you are. Go ahead.
Okay, thank you so much. Gracias a todos por acompañarnos en la sesión informativa de hoy. Esta tarde hablaremos sobre nuestras tendencias de casos, hospitalizaciones y muertes por estado de vacunación, grupo de edad, raza y etnia, y también revisaremos nuestro progreso en la vacunación, incluida la vacunación de los residentes confinados en sus hogares. Terminaremos con algunas ideas para garantizar que el día feriado del Día del Trabajo sea seguro, ya que todos nos tomamos un momento para rendir homenaje a las contribuciones y logros de nuestros trabajadores y sindicatos. First slide, please. Nos entristece informar 43 muertes adicionales hoy. Al menos 33 de las personas que murieron tenían problemas de salud subyacentes. Esto eleva el número total de muertes a 25.364 en el condado de Los Ángeles. A todos los que han perdido amigos y familiares durante este momento difícil, les deseamos paz y consuelo y nuestras oraciones están con ustedes. Hoy estamos reportando 2.741 nuevos casos, lo que eleva el número total de casos del condado de Los Ángeles a 1.412.240. A la fecha se han realizado pruebas a más de 8,1 millones de personas y sus resultados se han informado al condado de Los Ángeles. La tasa de casos positivos de nuestra prueba diaria es de 2,9%, un ligero aumento con respecto a la tasa del mismo día de la semana pasada de 2,75%. Nuestra tasa de casos promedio diaria con un retraso de 3 días es ahora de 22,3 casos por 100,000 personas, una disminución de más de 4 puntos porcentuales con respecto a la tasa de casos de la semana pasada con retraso de 3 días, que fue de 26,6 casos por 100,000. Actualmente hay 1.673 personas hospitalizadas con COVID, una disminución de 58 personas durante la semana pasada. A la fecha, hay 295 investigaciones abiertas en entornos residenciales congregados y entornos no residenciales con al menos un caso confirmado de COVID-19. Next slide, please. Para evaluar el riesgo de COVID en el condado de Los Ángeles, usamos los indicadores y umbrales de los CDC para categorizar el contagio comunitario de COVID-19. Observará que este marco utiliza una tasa de casos acumulada de 7 días, es decir, el número de casos por cada 100,000 durante la semana pasada, en lugar de una tasa de casos diaria. El contagio en el condado de Los Ángeles permanece en el nivel alto. Nuestra tasa de casos acumulada de 7 días, ahora de 59 casos nuevos por cada 100,000 residentes, lo que representa una disminución del 16% con respecto a la semana pasada. Esta es la segunda semana consecutiva con pequeñas disminuciones en nuestras tasas de casos. En general, estamos un 22% por debajo de nuestro pico de 204 casos por 100,000 del 19 de agosto. Next slide, please. A medida que el condado de Los Ángeles continúa implementando medidas de seguridad que nos ayudan a frenar la propagación, es útil observar nuestro progreso. Cuando comparamos los casos que se informaron la semana que finalizó el 15 de agosto con los que se reportaron la semana que finalizó el 22 de agosto, el condado de Los Ángeles pasó de ver casi 22,000 casos ahora ver cerca de 17,800 casos, una disminución del 19%. Mientras tanto, en el resto del estado, los casos reportados pasaron de más de 64,000 en la semana que terminó el 22 de agosto a poco menos de 62,000 en la semana que terminó el 29 de agosto, una disminución del 4%. Estamos agradecidos porque el número de casos continúa disminuyendo en todo el condado y el estado. Next slide, please. Este gráfico muestra las tendencias de casos, hospitalizaciones y muertes en nuestro condado desde el comienzo de la pandemia al 25 de agosto de este año. En el transcurso de la pandemia hemos visto casos en su punto máximo y en declive. Y como puede ver, el 25 de agosto los casos, aquí representados por la línea verde, estaban casi exactamente al mismo nivel que hace un mes, con un promedio levemente por debajo de 2.400 casos al día. Anticipamos que con el aumento de las pruebas por detección de rutina durante las próximas semanas, nuestro número de casos puede subir nuevamente. Las hospitalizaciones pueden estabilizarse o incluso disminuir levemente en su nivel actual de aproximadamente 1.730 personas hospitalizadas en un día determinado. Dado que las muertes se retrasan aún más con respecto a las hospitalizaciones, anticipamos que se seguirán registrando docenas de muertes cada día. La semana pasada vimos una disminución muy leve de alrededor del 11% con respecto a la semana anterior, es decir, 17 muertes en un promedio diario de 7 días. Sin embargo, las cifras reportadas ayer y hoy son más altas y sufrimos pérdidas continuas que son particularmente difíciles de aceptar, porque casi todas se pueden prevenir con vacunas COVID ampliamente disponibles y extremadamente seguras. Next slide, please. Casi siempre hacemos un seguimiento a la eficacia de las vacunas al analizar las experiencias de todas las personas vacunadas. Esta diapositiva muestra datos a escala para aquellos que están completamente protegidos por las vacunas. El gran recuadro verde representa los casi 5,3 millones de residentes que están completamente vacunados. El pequeño recuadro morado en la esquina inferior izquierda de este recuadro representa las 37.614 personas completamente vacunadas que dieron positivo por COVID al 31 de agosto del 2021. Si bien este es un aumento del 15% con respecto a la semana pasada, es importante anotar que menos del 1% de todos los vacunados se han infectado con COVID. De los que dieron positivo, 1.049 fueron hospitalizados frente a 881 la semana anterior. Eso se traduce en un aumento del 0,02% de todas las personas totalmente vacunadas que terminan hospitalizadas. Las muertes en este grupo durante este intervalo también aumentaron de 95 a 118, con un pequeño aumento de 0,0022% de las personas totalmente vacunadas que fallecieron. Esos pequeños aumentos evidencian que las vacunas no brindan una protección del 100% contra la infección. Y esto es una sorpresa, no es una sorpresa para nosotros. Cuando el contagio comunitario es alto, es probable que se infecten más personas completamente vacunadas. Pero estos números también nos muestran que si bien las vacunas son imperfectas, las personas que están completamente vacunadas están mucho mejor protegidas para evitar una hospitalización y la muerte por COVID. Next slide, please. En el siguiente conjunto de diapositivas mostraremos los resultados por estado de vacunación, estratificados por raza y etnia, así como por grupo de edad adulta. En estas diapositivas, los grupos no vacunados están representados por líneas de puntos, mientras que los grupos vacunados están representados por líneas continuas. Esta primera diapositiva muestra que la tasa de casos más alta se encuentra ahora entre las personas latinas no vacunadas, representada por la línea gris punteada, seguida de las personas blancas y afroamericanas no vacunadas, representada por las líneas punteadas azules y rojas. Después de meses de ver las tasas de casos más altas entre nuestras comunidades afroamericanas, esto representa un cambio notable. Se observan las líneas punteadas de color azul y gris que representan las tasas de residentes afroamericanos y latinos. Puede ver que la razón de este cambio es que las tasas entre los residentes afroamericanos han disminuido más rápidamente que las tasas en los residentes latinos. Puede ver en esta diapositiva lo diferente que es la imagen ahora que a finales de julio. El 24 de julio, 422 de cada 100.000 residentes afroamericanos no vacunados se infectaron con COVID, la tasa más alta entre todos los grupos raciales y étnicos, más de 4 veces más alta que la tasa en residentes afroamericanos no vacunados y casi el doble de las tasas en latinos y residentes blancos. Esto cambió en agosto, dado que los casos disminuyeron en todos los grupos. Next slide, please. Esta diapositiva que muestra las tasas de casos en adultos por grupo de edad observará que las tasas difieren considerablemente tanto por estado de vacunación como por grupo de edad. Las tasas más altas se encuentran entre los adultos no vacunados entre las edades de 18 y 49, representados aquí por la línea punteada morada. Las siguientes tasas de casos más altos se encuentran entre los adultos mayores no vacunados, representados por la línea punteada amarilla, y debajo de ellos los adultos jóvenes vacunados en la línea morada sólida y los adultos mayores vacunados en la línea sólida amarilla tienen las tasas más bajas. Los adultos no vacunados en ambos grupos de edad tienen de 4 a 5 veces más probabilidades de infectarse que los adultos vacunados. El mayor riesgo en las personas más jóvenes no vacunadas probablemente se deba a que se entremezclan con muchas otras personas en sus trabajos, en las escuelas y en su vida social. Notará que en todos los grupos los casos han alcanzado un punto máximo y ahora están disminuyendo. Esta tendencia es particularmente dramática en los grupos de edad no vacunados, que también tuvieron aumentos más pronunciados en los casos antes en esta ola de infecciones. La disminución puede estar relacionada con la implementación de capas adicionales de protección, incluido el uso universal de mascarilla en interiores y con aumentos en la cobertura general de vacunación, lo que reduce el número de personas que no están vacunadas y por lo tanto es más posible que se infecten. Next slide, please. Al examinar los datos de hospitalizaciones, puede ver una vez más las tasas de hospitalización más altas se encuentran entre los residentes afroamericanos no vacunados, representados por la línea azul punteada, seguidos por los residentes latinos y blancos no vacunados, representados por las líneas rojas y grises. Mientras tanto, las tasas de hospitalización siguen siendo muy bajas entre las personas vacunadas de todas las razas. Parece que las tasas de hospitalización disminuyeron para las personas afroamericanas no vacunadas durante las primeras 3 semanas de agosto y se han estabilizado para otros grupos, lo que brinda la esperanza de que si podemos mantener disminuyendo este número de casos, el número de hospitalizaciones también bajará posteriormente. Next slide, please. Cuando miramos por grupo de edad, quien está siendo hospitalizado ahora, podemos ver que la tasa de hospitalización más alta, sigue estando entre los adultos mayores no vacunados, representada aquí por la línea discontinua amarilla. Si bien ha habido cierta estabilización en las hospitalizaciones en este grupo de edad, los adultos no vacunados de 50 años o más todavía tenían 18 veces más probabilidades de ser hospitalizados que sus homólogos vacunados. Las hospitalizaciones en adultos jóvenes no vacunados, representados aquí por la línea apuntada morada, también están disminuyendo ligeramente. En relación con los adultos no vacunados, las tasas de hospitalización entre los adultos vacunados de todas las edades siguen siendo muy bajas. Next slide, please. Las vacunas continúan teniendo un fuerte efecto protector contra la muerte por COVID. Como puede ver aquí, las líneas de la tasa de mortalidad son casi planas en todos los grupos vacunados, mientras que las tasas de mortalidad en los grupos no vacunados fluctúan. En particular, mientras que las tasas de mortalidad en la mayoría de los grupos raciales y étnicos no vacunados se mantienen estables y con una tendencia a la baja, la tasa de mortalidad entre los residentes afroamericanos, que ya es la más alta, continúa aumentando al final de agosto. Dado que las muertes son un indicador que está rezagado en un promedio de 35 días, esto es probablemente una consecuencia del hecho de que las tasas de hospitalización en nuestras comunidades afroamericanas han sido más altas que las de todos los demás grupos raciales y étnicos durante la mayor parte de esta última oleada. Next slide, please. Al observar las tasas de mortalidad por grupo de edad, vemos que los adultos mayores no vacunados continúan teniendo un riesgo mucho mayor que cualquier otro grupo, vacunados o no. Los adultos no vacunados mayores de 50 años, representados por la línea discontinua amarilla, tienen 20 veces más probabilidades de morir de COVID que sus homólogos vacunados. Next slide, please. Nuestro reciente aumento de casos refleja la realidad de que la variante Delta ahora representa casi todas las cepas de COVID observadas entre las muestras secuenciadas en el condado de Los Ángeles. Como puede ver en este gráfico de barras que muestra el número de casos contabilizados por diferentes variantes de interés, las variantes Delta, representadas por las barras rojas, ahora representan el 99% de todas las cepas secuenciadas. Esta variante se contagia de manera más eficiente entre personas, probablemente debido a que se replica más rápido, a que tiene una mayor carga viral y tiene más afinidad por las células del tracto respiratorio inferior en comparación con las cepas anteriores de COVID. Y aunque los datos que han surgido afirman que las personas completamente vacunadas están bien protegidas de infecciones graves con la variante Delta, ahora está claro que las personas completamente vacunadas pueden infectarse y si se infectan con Delta pueden infectar a otras personas. Next slide, please. Nos gustaría informarles sobre casos y muertes entre el personal y los residentes de las instalaciones de enfermería especializada en el condado de Los Ángeles. Desde el 1 de marzo de este año hemos tenido 497 casos positivos entre el personal de centros de enfermería especializada y 264 casos entre los residentes. En nuestro número de 340 hogares de ancianos, contamos con 37.539 empleados y 26.337 residentes. Entre los casos positivos, el 42% fue en personas completamente vacunadas. Esto se debe en parte a la gran cantidad de residentes y personal completamente vacunados en estos centros. Al 26 de agosto, el 87% de los residentes y el 88% del personal de las instalaciones de enfermería especializadas en el condado de Los Ángeles estaban completamente vacunados. También hemos visto 10 muertes entre los residentes de instalaciones de enfermería especializada, un tercio de las cuales fueron personas completamente vacunadas. Casi todas estas muertes ocurrieron entre residentes que tenían problemas de salud graves. No se han reportado muertes entre el personal de estas instalaciones. Esto contrasta mucho con las experiencias en los hogares de ancianos durante las oleadas anteriores. Durante el aumento invernal entre el 1 de noviembre del 2020 y el 28 de febrero de este año, 9.021 residentes se infectaron y 2.040 murieron. También tuvimos una gran cantidad de personal afectado, con 4.554 personas infectadas, entre quienes 46 murieron. Entonces, aunque seguimos viendo un cierto contagio de la variante Delta en nuestros hogares de ancianos durante el aumento actual, las vacunas claramente han cambiado las reglas del juego al ofrecer protección extraordinaria contra una significativa propagación. Next slide, please. Como siempre, dado el poder de las vacunas, seguimos enfocados en facilitar la vacunación entre quienes aún no están vacunados. Al 29 de agosto, el 91% de los residentes del condado de Los Ángeles de 65 años o más habían recibido al menos una dosis de la vacuna, al igual que el 75% de los residentes de 16 años o más y el 75% de los residentes de 12 años o más. El 75% de los residentes de 12 años o más han sido completamente vacunados. El 62% de los adolescentes del condado de Los Ángeles entre las edades de 12 y 17 han recibido al menos una dosis y el 51% está completamente vacunado. En todo el condado se han administrado casi 36.000 terceras dosis a personas inmunodeprimidas. De todos nuestros casi 10,3 millones de residentes del condado de Los Ángeles, incluidos aquellos que aún no están aprobados para recibir la vacuna, el 64% ha recibido al menos una dosis y el 56% está completamente vacunado. Next slide, please. Este cuadro muestra el número de primeras dosis administradas cada semana, aunque tenga en cuenta que debido a un retraso en el informe de datos, las cifras de la última semana a menudo subestiman el número de dosis administradas entre 4.000 y 10.000 dosis. Actualmente la tabla indica que entre el 16 y 22 de agosto administramos un poco más de 63.000 dosis en toda la red del condado, pero esperamos que este número aumente un poco a medida que se informen dosis adicionales. Para evitar estos ciclos de aumento repentinos, necesitamos que este número aumente significativamente si queremos tomar un camino diferente en los próximos meses. Si bien estamos agradecidos con quienes se han vacunado, debemos continuar explorando la forma de hablar entre las personas sobre las vacunas para comunicar la realidad de que son seguras y eficaces, para motivarlas en lugar de ahuyentarlas. Next slide, please. Las brechas persistentes en la cobertura de vacunación entre los subgrupos de edad y raciales y étnicos continúan acechándonos. Los grupos con tasa de vacunación inferiores al 50% están marcados en rojo, mientras que el resto está en blanco. Si bien nos complace ver grupos vacunados a tasas superiores al 50%, debemos confrontar la realidad de lo que no aparece en esta diapositiva. El porcentaje de personas en cada uno de estos subgrupos que no están vacunadas. Estas son las personas que más nos preocupan, aquellas que no han recibido ni una sola dosis de la vacuna. Repetidamente escuchamos informes de trabajadores de salud que atienden a adultos gravemente enfermos, muchos de ellos padres con niños pequeños para quienes ya es demasiado tarde vacunarse. También escuchamos sobre hospitalizaciones y ocasionalmente muertes trágicas entre adultos jóvenes no vacunados que optaron por no recibir la vacuna porque no creían que el virus fuera una amenaza. Estas personas y tantas otras son las que faltan en este cuadro y son a las que debemos llegar si queremos poner fin a esta pandemia. Por lo tanto, aunque nos alegra ver que todos los grupos de edad sumados en la casilla inferior del gráfico han alcanzado un valor de referencia del 60% de vacunados, debemos enfocar nuestros esfuerzos en las personas no vacunadas que se encuentran en las brechas. Como puede ver en la columna de la derecha, hay una gran cantidad de personas no vacunadas en casi todos los grupos raciales y étnicos, aunque las comunidades afroamericanas y de color tienen proporciones más altas de personas no vacunadas. No es una coincidencia que las comunidades con el menor índice de vacunación sean las que históricamente han tenido el menor acceso a una atención médica de alta calidad. Y si bien la reparación del daño causado por el racismo estructural no sucederá de la noche a la mañana, necesitamos ver avances más rápidos para revertir la desproporción en los casos, hospitalizaciones y muertes que, como muestra esta tabla, están tan estrechamente vinculados al estado de vacunación. Next slide, please. Con el apoyo de muchos aliados de vacunación en todo el condado, podemos ver aumentos en las tasas de vacunación en comunidades con una baja cobertura de vacunación persistente. Las tasas más altas de vacunación representadas en verde oscuro en este mapa, incluyendo ciudades y comunidades del norte como Santa Clarita y Stevenson Ranch, áreas al este de nuestro condado, incluyendo West Covina y partes del centro de Los Ángeles, incluido Burbank. Todo el condado de Los Ángeles les agradece por hacer su parte para frenar la propagación. Next slide, please. Hemos continuado con nuestra estrategia para mejorar el acceso a las vacunas al hacer que los equipos móviles de vacunación lleven las vacunas a lugares donde podemos alcanzar a las personas que no han sido aún vacunadas. Los marcadores azules en este mapa indican los 480 sitios donde nuestros equipos móviles están ofreciendo vacunas esta semana, muchos de los cuales se concentran en las áreas de mayor necesidad y más afectadas. Nuestros equipos móviles de vacunas trabajan para llevar las vacunas a los lugares donde se reúne la gente en el vecindario y están ansiosos porque las vacunas estén fácilmente disponibles para usted. Aunque cualquier persona puede solicitar un equipo móvil en nuestro sitio de internet y mientras tanto buscar a nuestros equipos en los lugares de su comunidad donde se reúne la gente. Next slide, please. Garantizar el acceso a las vacunas de nuestros residentes más vulnerables es una de nuestras principales prioridades y nuestro programa de vacunación en el hogar ofrece visitas domiciliarias para vacunar a quienes no pueden salir de sus casas. Si está confinado en su hogar, puede pedir que lo incluyan en este programa, pero también lo pueden hacer quienes lo cuidan, sus familiares, seres queridos, proveedores de atención médica, organizaciones, etc. A la fecha, a través de este programa, hemos vacunado a 2,000 residentes confinados en sus hogares en el condado de Los Ángeles. Y también podemos ofrecer dosis adicionales a los residentes inmunodeprimidos a través de este programa. Para enviar una solicitud, acceda a nuestro formulario de solicitud de vacunación domiciliaria en el sitio de internet que aparece en esta diapositiva o llámenos al 1-833-540-0473 entre las 8 de la mañana y las 8:30 de la noche los 7 días de la semana. Podemos atender llamadas en varios idiomas. Una vez que hayamos recibido su consulta, los proveedores de telefonía móvil se comunicarán directamente con el cliente en un lapso de 7 a 10 días para programar una cita. En nuestro sitio de internet de vacunas puede hacer clic en el botón Vacunación en el hogar que se encuentra en el menú de la izquierda de la página para obtener más información. Next slide, please. Al entrar en el fin de semana a celebrar el Día del Trabajo, muchos de nosotros tendremos la oportunidad de participar en una variedad de actividades con amigos y familiares y muchos de nosotros nos preguntaremos si es seguro hacer las cosas que queremos hacer. Al hacer planes, puede ser útil pensar en los diferentes lugares de donde proviene el riesgo cuando participa en esa actividad. Para empezar, existe su propio riesgo personal. Ese riesgo es un espectro y cambia en función debido a una gran cantidad de factores. Reduce su riesgo personal el hecho de que todos en su hogar, incluido usted, estén vacunados. También lo reduce si trabaja solo o en casa, si es menor de 65 años, si tiene un sistema inmune saludable y si no sufre de enfermedades crónicas. Por el contrario, aumenta su riesgo personal si hay personas no vacunadas en su hogar, si mantiene un contacto cercano con otras personas en el trabajo, si es mayor de 65 años, si su sistema inmune está debilitado o si padece de afecciones crónicas. No todos son iguales. Hay una diferencia, por ejemplo, entre tener un bebé no vacunado en casa y vivir con 4 adultos no vacunados que van a trabajar y se mezclan mucho socialmente. Y estas no son ciertamente todas las características que contribuyen al riesgo personal, dónde vive, qué tan fácil y seguro es acceder a la atención médica y muchos otros factores aumentan o disminuyen el riesgo. Pero considere esto como un plan para comenzar a evaluar e incluso de alguna manera calificar su propio riesgo personal. Es una buena idea saber si está más cerca del lado de menor riesgo o del lado de mayor riesgo en este espectro. Next slide, please. Una vez que haya tomado un tiempo para pensar en su propio riesgo personal, piense en el riesgo de las actividades en las que desea participar. Estos también se encuentran dentro de un espectro de riesgo. Las actividades que se realizan al aire libre por lo general tienen un menor riesgo que las actividades que se hacen al interior. Saber que todas las personas involucradas en una actividad estarán completamente vacunadas reduce más el riesgo de esa actividad, mientras que no conocer el estado de vacunación de los demás o saber que otros no están vacunados aumenta el riesgo de las actividades con esas personas. Las actividades en lugares con poca gente generalmente conllevan menos riesgos que las que involucran multitudes, al igual que las actividades en las que usted y otros usan mascarillas durante la duración de la actividad. Y por último, las personas tienen menos probabilidades de contagiar infecciones durante un entrenamiento cuando están calladas que cuando cantan, gritan o tienen la respiración agitada como cuando se hace ejercicio. Algunas actividades se ubicarán por completo en un extremo u otro del espectro. El club de lectura con uso de cubrebocas y distanciado en su patio trasero podría tener todas las cualidades del lado de menor riesgo del espectro. Mientras que una fiesta estridente podría tener todas las cualidades en el lado del mayor riesgo del espectro. pero muchas actividades tendrán algunas cualidades de ambos lados. Por ejemplo, si todos los que se reúnen en el patio trasero se paran y no usan mascarilla cuando están juntos y se ubican alrededor de la mesa de bocadillos durante media hora, aumentará el riesgo de esa actividad. Una vez más, el riesgo de actividad es un espectro. Si todos participaran en actividades de menor riesgo, independiente de su riesgo personal, muy pocas personas contagiarían o se infectarían con COVID. Pero por necesidad o deseo, las personas se involucran en actividades de alto riesgo, incluidas las personas de alto riesgo personal. Next slide, please. Entonces, ¿qué hacemos con esta información? Al evaluar su riesgo personal, recuerde que está evaluando solo el riesgo para usted, pero si vive con otras personas en su hogar, existe un riesgo adicional para cada persona con la que vive. Cuantas más protecciones tenga usted y los miembros de su hogar, más seguro estarán usted y sus seres queridos. Otras protecciones pueden implicar la modificación de la actividad en sí, como abrir algunas ventanas o puertas o alentar a sus amigos a trasladar una reunión al exterior donde todos pueden esparcirse. Cuanto mayor sea su riesgo personal y mayor el riesgo de la actividad, más importante es agregar protecciones antes de salir a disfrutar todo lo que Los Ángeles tiene para ofrecer. Next slide, please. Para ver un ejemplo de cómo funcionaría. Next slide, please. Para ver un ejemplo de cómo funcionaría, imagine una familia de 4 con 2 adultos vacunados y 2 niños pequeños no vacunados. Quieren asistir a una gran feria en un parque local patrocinado por la ciudad con atracciones, puestos de comida y fuegos artificiales. Se estima que asistirán otras 5,000 personas. Cuando mamá piensa en el riesgo personal de su familia, piensa en sus 2 hijos no vacunados. También piensa en su pareja que trabaja en el comercio minorista, pero usa mascarilla todo el tiempo en el trabajo. Tanto ella como su pareja tienen más de 30 años y está agradecida de que ambos están sanos. Ella estima que su riesgo personal como familia probablemente se encuentre en el rango medio. Mientras tanto, cuando evalúa el riesgo de ir a la feria, piensa en las atracciones que están al aire libre, como los carruseles y la vuelta al mundo, así como la multitud en el puesto de lanzamiento de aros o al interior de la Casa de la Risa. Ella señala que la feria no requiere prueba de vacunación para ingresar y espera que algunas personas usen mascarillas, mientras que otras no. Y espera que sea lo suficientemente divertido para que mucha gente se ría y grite. En general, estima que como actividad la feria tiene un riesgo medio a alto, aunque sabe que el riesgo es variable y sabe lo que puede hacer para protegerse a sí misma y su familia. Esta familia puede ir a la feria, protegerse y pasar un buen rato. ¿Cómo? Usando protecciones acordes con el riesgo de la actividad. Usar mascarillas, excepto cuando están en la atracción La Vuelta al Mundo y cuando comen helado en el muelle, mientras disfruta de las actividades al aire libre y de los juegos mecánicos, alejada de los juegos del carnaval y de la Casa de la Risa. Y en general, evitando las zonas más concurridas de la feria, lo que podría significar ver los fuegos artificiales alejada de grandes grupos de personas. ¿Qué pasa si uno de los padres es diabético? O el abuelo, quien toma un medicamento inmunosupresor, cuida a los niños mientras los padres están en el trabajo. Eso cambia su riesgo personal, por lo que también deberían cambiar sus cálculos. Puede optar por una actividad de menor riesgo, como una reunión al aire libre, donde saben que todos los amigos y familiares están vacunados. O si van a una feria, es posible que todos se pongan una mascarilla doble y tengan mucho cuidado al permanecer en la periferia de la acción, especialmente cuando comen o beben. Aunque parte de lo que hacemos con nuestro tiempo no depende de nosotros, todos tenemos algunas decisiones que podemos tomar sobre cómo vivimos nuestras vidas en ese momento. Hay un gran poder para protegernos a nosotros mismos y a los demás en esas decisiones y abordarlas con consideración en nuestro camino a través de esto juntos. Antes de terminar, quisiéramos corregir algo que se dijo como respuesta a una pregunta ayer. Nos preguntaron qué proporción de todas nuestras pruebas estaba compuesta por pruebas de vigilancia del distrito escolar y calculamos que era aproximadamente el 60%. Después de mirar los números de las últimas semanas, el número correcto está de hecho más cerca del 40%. Muchas gracias y hasta la próxima.